Regional Medical Center is doing something that's unique here so that we can keep patients here, provide access to services, and have a response time that's exceptional for the people that are receiving care in our facility. So without further ado, I'd like to introduce the good doctor.
Thank you. So it's a pleasure to be here at Kearney. I think that my collaboration with Kearney started in November of last year. It was the first time that I was here. It was around after Thanksgiving. And since that day, I have been having this close collaboration with Kearney Regional Medical Center. We start with the fine needle aspirations. That is part of the cytology. But we were trying to figure out how to do the evaluation or adequacy of this fine needle aspiration. It's difficult to be here for every single one when we are 3 hours away from Kearney. So at UNMC, I did one technology or validate one technology that is called Telecytology. Normally, we can have like a camera incorporated to a microscope. But I was trying to find like a simple solution that was cost effective and easy to use. So what we did the validation using an iPad and with an adapter in a double head microscope, and using the iPad, the cytotech or the person that is moving the slides on the microscope will call me anywhere. So when we have an FNA at Kearney, we have Lisa Kennedy, that is amazing. She will call me using the iPad to my office. So I will see that image that is on the microscope, on the slide, on my desktop. 3 hours away, 180 miles away. So what is rapid on-site evaluation? Because I think that we need to be familiar what is rapid on-site evaluation, what we call ROSE. So we check the cellular contents of the fine needle aspiration smear, and then we tell the operator, the clinician, or the surgeon of the interventional radiologist if we have enough sample. So what is the beauty of rapid on-site adequacy? We avoid having to repeat the procedure again. So we can tell the patient right away that we have enough sample. So if we don't perform ROSE, the patient will go back home. So in 2 weeks, we will have to tell the patient, you know what, you need to go back for the procedure because we didn't get enough sample. So that doesn't happen with rapid on-site adequacy because then it's cost effective. In October of last year, we did the validation of the telecytology, so that is rapid on-site adequacy, but using remote connection. As you can see, we have the iPad on the adapter, and this is Troy Matias, our supervisor from our cytology division, and then we use Skype for Business to make the call. Why we use Skype for Business? Because Skype for Business is HIPAA compliant. We are not using FaceTime, Snapchat, or that kind of social media, because Skype for Business is the one that is HIPAA compliant, because we need to give 2 identifiers, the patient name and the date of birth, so that's patient information. And then this is me in my office. You can even see my kids drawing, and I have a double screen, so here I am, and then I'm looking at the screen from the cytotext. And this is Lisa at Kearney in our frozen section room with the iPad. And then this is me in my office looking at the material. So this is what we do. We are really happy at our department. It has been like an amazing experience to provide all the expertise and to have this big collaboration with Kearney. Kearney Regional is our first telecytology outreach client right now. So this is an innovation for us.